Hello, I'm Mark Hudson-Peacock. I'm the Medical Director of eXroid, and I'm here to talk about haemorrhoids and their treatment. So what treatments are available for haemorrhoids? Well, broadly, there are three approaches. One is simple symptomatic improvement by using a variety of creams and suppositories, along with a high fibre diet and plenty of water, the latter being pertinent to all treatments to help reduce recurrence. The second group are surgical treatments, usually requiring anaesthetic, and the third are non-surgical treatments, typically not requiring anaesthetic. There are a number of different treatments available for managing haemorrhoid symptoms. The ones that most people will have heard about are banding and haemorrhoidectomy. They're the ones that are typically available on the NHS. But there are many other treatments available, some within the NHS in some areas, but many of them available in the private sector. I'll go through these in turn. So dealing with banding, which is the most commonly carried out treatment in the UK, probably accounting for between 60 and 70% of treatments undertaken. This is usually carried out in an outpatient setting, which means you will go in, have the treatment, and go home again the same day. Banding is pretty much as it sounds. A rubber band is placed on the base of a targeted haemorrhoid, and typically 1 or 2 bands are applied at a treatment sitting. After about 7 to 10 days, the haemorrhoid has strangulated and falls off. It can be uncomfortable, but most people find it quite tolerable, with some exceptions. When the haemorrhoid falls off, there is sometimes a complication of bleeding at that point, because the small area still needs to heal at the base. Haemorrhoidectomy. So haemorrhoidectomy, the other common treatment, probably accounting for about 20% of NHS treatments each year, involves cutting the haemorrhoid out. This is carried out under a general anaesthetic in a hospital and may require 1 or 2 nights stay, assuming that no complications arise at that point. It is typically very painful afterwards. Indeed, it is said to be the most painful operation to get over during that first 2 weeks in the post-op recovery period. The healing process, however, will continue for some weeks after that. And so some time is needed to be taken off work to be able to recover fully. Most people with banding don't really need to have a long recovery period. How about some of those other treatments? Well, sclerotherapy is injections, typically carried out without any anaesthetic in the outpatients. Patients come in, have the injections, and go home again. Can be a bit uncomfortable, but typically well tolerated. Not as effective as banding or haemorrhoidectomy in the studies that have been looked at, though. And typically multiple treatments can be required. Various heat treatments can be considered. Raffaello, or which is a form of radio frequency, can generate heat. Laser, using light, can also generate heat. Alternating current can generate heat, and so can infrared coagulators. So heat is a very useful modality. And a bit like when you put a bit of bacon in the frying pan, you get shrinkage. That's essentially what heat is doing to the tissues when applied to the base of the haemorrhoid. You get tissue shrinkage, and blood vessels coagulate off and shrink. And it's important with all the treatments for hemorrhoids that we reduce the blood supply. Otherwise, a more permanent fix is not going to be undertaken. Other treatments that are carried out under a general anaesthetic include halo or THD, where the areas are targeted and then when the blood vessels have been identified using a Doppler, they are tied off, stitched off. Some places do not use the Doppler to listen for the blood vessels, they just treat them. And it's been found in studies that it's not necessary always to know exactly where the blood vessels are, because there's not a large area where they can be sighted, and stitching done blind is adequate. The other treatment is stapling, or PPH, which stands for Procedure for Prolapsing Hemorrhoids, which is a mini bowel resection. So having identified where the base of the hemorrhoids are, a small amount of bowel is removed, including the hemorrhoids, and the area is then stapled together as an alternative to stitching. The recovery period from PPH and from halo/THD is a bit quicker than after a hemorrhoidectomy, but again the results are not quite as good as hemorrhoidectomy in terms of the number of patients that get over it and who may require further treatment subsequently. But the recovery period is typically a lot quicker than with hemorrhoidectomy.
What are the different types of hemorrhoids?
Having told you about other treatments for internal hemorrhoids, I now want to go on and tell you about eXroid direct current electrotherapy. So eXroid is a treatment that is quite unique in the sense that it can be used to treat all 4 grades of hemorrhoid, from the smallest grade 1s to the largest grade 4s and everything in between. That differs to the other treatments which are not used across all 4 grades. So typically banding will be used for larger grade 1s, grade 2s and smaller grade 3s. Hemorrhoidectomy will be used for treating the larger grade 3s and grade 4s. The other treatments that I mentioned earlier will have variable size hemorrhoids that they will be suitable for. But again, I reiterate, eXroid is a treatment that can be used across all 4 grades of hemorrhoid. It involves no cutting, no stitching, no need for any anaesthesia, and therefore patients can go home straight after the treatment has been undertaken. Minimal discomfort during the treatment, minimal discomfort after the treatment, with the occasional exception, but in those situations simple paracetamol is usually all that's required. And typically by the following day, everyone is back to doing what they normally do.